Hello and welcome to Time with Dr. Racheal. So how have you been? Today we're going to be talking more about abnormal uterine bleeding. So that's like bleeding that is not your menstrual menses. When you find yourself bleeding, at odd times of your menstrual cycle, you should be worried. Or if the bleeding is very heavy, heavier than expected, heavier than you are aware of or you're used to, you should actually find out why this is happening. And the reason why we're bringing this topic today is a lot of women have what we call endometrial hyperplasia, which is abnormal growth of the cells within the lining of the womb, and they don't really get to know on time. Now, this condition actually gives you a long period of time, many years, before it ends up being endometrial cancer, which is not nice. That's very bad. How can you discover on time? Now, some women are at a high risk of having this condition. What do I mean high risk? If you have some hormonal imbalance, when you do not see your periods regularly, like women with polycystic ovarian syndrome, or you have a family history of a metabolic disorder, so there could have been history of obesity, that is increased body weights, weight to height ratio is increased, or you have complaints of hypertension, hypertensive disorders, that is when your blood pressure is elevated and you're probably on medication, and all of this, or family history of some gut cancer, that is cancer of structures in your gut, like bowel cancer, or a family history of breast cancer. So that all of these conditions are kind of enveloped together, intertwined. So you need to really know, what's my family risk of this condition? Do I have any genetic risk? And my periods just ended 5 days ago. Why am I spotting? You need to increase your self-awareness. And please stop being lazy, lethargic, or scared of getting checked to find out, why has something changed in my body? I know that as women, we have a lot of things that we do. You need to take care of yourself. You need to watch out for your husband, your partner, your kids, your family, your work, your friends, your environment, your pets. There's so much to do, but you're also part of this so much. And we push so hard and then we break. And that's not good enough. Because what's the benefit? Now back to this. So when you have a condition where you're seeing abnormal bleeding, you're having abnormal bleeding, either heavy menstrual bleeding, or you're having intermittent bleeding, spotting during your period, your cycle, you should be worried. Now there are various other things that could result to that. Apart from what I've mentioned, it could also be that you have something as simple as a uterine fibroid. I'm like, why are you saying that's simple? I say simple because the risk of it changing or transforming into cancer is very, very low. It could also just be that you have a growth in your cervix. Maybe you have a fibroid growing within the mouth of your womb, and that could also cause this heavy bleeding. Or there are other problems with the mouth of your womb, like maybe it's inflamed, that means it's infected, there's a bug in there, or you have early changes of the cells, that is the cells that are in the mouth of your womb, all right, or you actually have cervical cancer. So you see why bleeding heavy during your periods, in between your periods, or you have an abnormal discharge, you should actually find out why. So when women do come in to complain about these things, the first thing is to take a detailed history to find out when it started, how long it's been for, how heavy is it, any changes, any weight loss, any bumps, lumps in any other part of your body. All of this needs to be looked into. Also, any family history. Then, of course, examination from head to toe to see if it has affected you in any way in terms of you having low blood levels, and that could be seen during your evaluation. Then blood samples to see what the level of your blood level is, any other abnormalities, and then the camera test. Yes, we're back with the camera test to check in the lining of your womb to see how thick it is, what does it look like, any abnormalities within the womb. And when we find out all of this, we have to look below, looking down below to look at the mouth of your womb with, trying to see it exactly, is there anything, any masses, anything to be worried about. Sometimes we immediately take samples. That means we take a test of the cells within the mouth of the womb, and we even use a camera test to take the cells within the lining of your womb. Now, if we so discover that this patient or you have endometrial hyperplasia, there are lots of things to do. First, we need to do what we call a risk assessment so that you get a tailor-made treatment. And when we do a risk assessment, it has to be a multidisciplinary approach. And we have a team of doctors, a team of specialists who are going to take care of your specific needs. It could be weight gain, and then if weight loss exercise would be, designed for you. It could be diet, lifestyle changes, and then of course medication to actually help to halt that excessive growth and regress it and let it go away. Or we need to put in a device within the lining of your womb that would locally stop this excessive growth, and then multiple follow-ups. I hope I've been able to shed light into what abnormal uterine bleedings are, and the fact that endometrial hyperplasia is a possibility, is a possible cause of abnormal uterine bleeding. So if you want to know more about this, or you've experienced this kind of symptoms, we really want to know what it's been for you in the comment section. And we'd like you to like our videos, subscribe to our channels, and of course turn on your notification buttons to know when we have updates on your health. For now, bye.